Counties Armagh Darlington is a big organisation. It's a very complex trust. And as the Director of Nursing, the things that worry me most are things that might relate to what might be perceived as failures in nursing. When we talk about that, we very often think about what we used to call bed sores, pressure ulcers. It's usually an indication of not being able to move patients effectively, help them change their position and provide the right repositioning aids to keep their pressure areas intact. Counties Armagh Darlington last year reported 4 avoidable pressure ulcers. Out of the tens of thousands of contacts that we have, that is world class. Next month, I'll be giving out 28 certificates to wards and departments that have been pressure ulcer free for 5 years. That is extraordinary. And as the Director of Nursing, that's something I'm incredibly proud of, because it means that every nurse, every midwife, every healthcare assistant applies attention to detail all of the time in assessing patients' risk and keeping them moving and keeping their skin perfect. And for that, I'm enormously proud as the Director of Nursing. So I've been working in the NHS for nearly 40 years, and the scale of change has been enormous. The volume of patients, the complexity of their needs, the number of older patients we now nurse with very comorbid, complex problems. Because of advances in medical technology, people are living longer, which also means that they become more dependent and require more care. One of the targets that we all focus upon is waiting times in accident and emergency. And sometimes we think we become obsessed with that. But in the period of time that I've been working in the service, we've gone from a position whereby patients would regularly wait months for operations, sometimes years, and languish in the emergency department for 12 or more hours. That's not just personally unacceptable, but it leads to harm. So the fact that if a patient waits more than 4 hours, we consider that to be an extraordinary lapse and try very, very hard to make sure they are seen promptly and dispersed to a ward for ongoing treatment or sent home having been offered medicines or other forms of treatment is, I think, a hallmark of the improvements that the NHS have made in the last certainly 40 years and probably 70. So waiting times make a huge difference to patients because it reduces harm and improves the quality of the patient's experience, and that's something I'm very proud of. Finally, I would just like to say a big thank you to all of our staff. Every day, every moment of every day, 365, 24/7, nurses, doctors, healthcare assistants, scientists, allied health professionals, managers, laboratory staff do extraordinary things to make sure we get the right answer about every patient, that we can identify the most personalised treatment to offer those individuals. We can support their families and their carers. And that's only because of the altruism and dedication of everyone who works at Counties Armagh Darlington NHS Foundation Trust. As the Director of Nursing, clearly I take personal responsibility for a lot of those things that will improve the well-being of our population, but it also makes me very proud that I can be identified as being a leader in an organisation that prizes the welfare of our population, our citizens, so highly. And for that, I'd like to thank each and every one of you for what you do every day. Thank you.